Who is most at risk for kidney disease? The 10 most vulnerable groups. Your kidneys are working hard right now, filtering your blood and keeping you alive. But for millions of people, these vital organs are slowly failing, often without any obvious symptoms. Shockingly, nearly 90% of people with chronic kidney disease, CKD, don't even know they have it because they aren't aware they're at risk. CKD is one of the fastest growing chronic diseases and a leading cause of death worldwide. Once CKD develops, kidney function rarely returns to normal, which is why early detection is so critical. Today, we'll uncover the 10 groups most at risk for kidney disease, ranked from highest to lowest. This isn't just about statistics, it's about protecting yourself and your loved ones. If you see yourself on this list, we'll also share simple, practical steps you can take to safeguard your kidney health. Before we dive in, please note that all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. People over 60 while young to middle-aged adults, ages 20 to 60, are generally not considered high risk for CKD. The risk increases significantly after age 60. A 2014 study published in the Journal of Clinical Practice found that about 11% of U.S. adults have CKD, but that number jumps to 39.4% for those over 60. Another study from 2010 showed that only 2.7% of people aged 18 to 29 had kidney abnormalities, compared to nearly 58% of people in their 60s. So, why are older adults more vulnerable? It's largely due to the natural aging process. As we age, our kidneys undergo several changes. They lose mass, have fewer functional filtering units, called nephrons, and their surface becomes rougher. Additionally, the blood vessels that supply the kidneys, renal arteries, become hardened and narrower. These changes cause the kidneys to filter blood more slowly, leading to a buildup of waste and toxins in the body. Aging kidneys also struggle to maintain proper fluid and electrolyte balance, which can lead to dehydration, metabolic imbalances, and increased acidity in the blood. Oxidative stress, inflammation, and fibrosis, common in aging, also play a significant role in the development of CKD. Conditions like high blood pressure, diabetes, and obesity can further accelerate kidney decline in older adults. For seniors, the key to maintaining kidney health is staying well hydrated and eating a diet rich in antioxidants and natural foods, such as vegetables, low-sugar fruits, white meat, and fatty fish. Regular exercise to improve circulation and controlling sodium intake are also crucial for slowing kidney aging. People with diabetes is the leading cause of kidney disease, accounting for approximately 40% of newly diagnosed CKD cases. In fact, about 1 in 3 adults with diabetes will develop kidney disease. The connection between diabetes and kidney damage is straightforward. Consistently high blood sugar levels cause inflammation and damage the blood vessels in the kidneys over time. The longer someone has diabetes or the worse their blood sugar control, the higher their risk of kidney damage. Research shows that about 8% of newly diagnosed type 2 diabetes patients already show signs of kidney disease, such as protein in their urine, proteinuria. Interestingly, type 2 diabetes can be more aggressive than type 1 in damaging the kidneys, especially in younger individuals. A 2012 Canadian study followed 342 young people with diabetes and found that those with type 2 diabetes were 4 times more likely to develop kidney failure compared to those with type 1 diabetes. For people with type 2 diabetes, the risk of kidney damage increases with age and the presence of other health conditions. If you have diabetic retinopathy, eye problems caused by diabetes, it could also indicate a higher risk of kidney damage. The good news? If you have diabetes, you can significantly reduce your risk of kidney disease through careful management. This includes tight blood sugar control, regular exercise, at least 150 minutes per week, and a balanced diet low in sodium and processed foods. Aim to keep your A1C level below 7%, a measure of your average blood sugar over the past 3 months. Regular screenings, at least annually, are also essential for early detection. Certain medications, such as ACE inhibitors or SGLT2 inhibitors, have shown promise in protecting the kidneys in people with diabetes. And remember, even prediabetes can start affecting your kidneys, so early intervention is critical. People with hypertension, high blood pressure damages the small blood vessels in your kidneys, impairing their ability to filter waste. Over time, this can lead to chronic kidney disease, CKD. Hypertension causes 27% of end-stage renal disease, ESRD, cases in the U.S. It usually takes about 10 years of uncontrolled hypertension to cause significant kidney damage, giving you time to act. To protect your kidneys, aim for a blood pressure below 130/80 mmHg. Limit salt, eat potassium-rich foods, like bananas and leafy greens, and follow a Mediterranean diet. Regular exercise, stress management, and medications like ACE inhibitors or ARBs can also help. People with a family history of kidney disease. If kidney disease runs in your family, your risk is higher. A 2009 study found that 23% of dialysis patients had close relatives with ESRD. Regular screenings and genetic counseling can help you understand your risk. Even with a genetic predisposition, lifestyle changes like maintaining a healthy weight, controlling blood pressure, and eating a low-sodium diet can delay or prevent kidney disease. People with heart disease and kidney disease are closely linked. Conditions like heart failure reduce blood flow to the kidneys, increasing CKD risk. A study found that higher heart rates raised CKD risk by 10% and proteinuria risk by 20%. To protect your kidneys, maintain stable blood pressure and heart rate, and monitor kidney function regularly. Medications like spironolactone may need adjustment to avoid kidney strain. Stay active with low to moderate intensity exercises and follow a diet combining the DASH and Mediterranean plans. Include omega-3 fatty acids from fish oil, which can lower cardiovascular risks and support kidney health. Obese individuals' obesity significantly increases the risk of kidney disease. Research shows that as BMI rises, so does the risk of declining kidney function. A BMI of 30 increases the risk by 18%, while a BMI of 40 more than doubles it. Belly fat, or visceral fat, is especially harmful, as it increases pressure on the kidneys and releases inflammatory substances that damage them. The good news? Weight loss can be transformative. A 2021 study found that participants in a weight loss program had a 40% lower risk of severe kidney problems and were 92% more likely to see improved kidney function. Focus on gradual, sustainable weight loss through a balanced diet and regular exercise. Aim to keep your waist circumference under 31.5 inches, 80 centimeters, to reduce visceral fat. Heavy salt, sugar, and protein eaters. A diet high in salt, sugar, and protein can overwork your kidneys. Excess salt raises blood pressure and directly damages kidney filters, while too much protein increases nitrogenous waste and forces the kidneys to work harder. High sugar intake can lead to diabetes, hypertension, and obesity, all major risk factors for kidney disease. To protect your kidneys, limit daily sodium to under 2,300 milligrams, added sugars to less than 25 g for women and 36 g for men, and consume protein in moderation, 0.8 g per kilogram of body weight. For CKD patients, the recommended protein intake is 0.55 to 0.60 g/kg/day. Adopting a Mediterranean diet, rich in fruits, vegetables, whole grains, and lean proteins, can help. It's naturally low in sodium and sugar, making it kidney-friendly and beneficial for overall health. Smokers or heavy alcohol users. Smoking damages kidneys by increasing oxidative stress and inflammation, reducing blood flow, and impairing their ability to filter waste. A 2013 study found that for every 5 additional cigarettes smoked daily, kidney dysfunction markers like serum creatinine increased by 31%. Heavy alcohol use raises blood pressure, damages the heart and liver, and dehydrates the body, all of which strain kidney function. While some studies suggest light to moderate drinking might have benefits, alcohol's risks outweigh any potential perks, especially for those with CKD or other health issues like diabetes or heart disease. The best strategy? Quit smoking and limit alcohol. For women, stick to 1 drink per day, and for men, 2 drinks max. 1 drink equals 14 g of pure alcohol. Focus on staying hydrated and loading up on antioxidants from fruits and vegetables instead. People of specific races and ethnicities. Certain racial and ethnic groups face a higher risk of CKD due to genetic and socioeconomic factors. African Americans are 4 to 5 times more likely to develop kidney disease, partly due to genetic variations in the APOL1 gene, which can increase kidney failure risk by up to 10 times. Over 1/3 of U.S. kidney failure patients are African American. Hispanic Americans have a 1.5 times higher rate of ESRD than non-Hispanic Americans, with higher rates of obesity, diabetes, and CKD complications. Asian Americans, Native Americans, especially Pima and Zuni tribes, and Pacific Islanders also experience higher rates of diabetes, a leading cause of CKD. If you're in one of these groups, regular checkups, good blood sugar control, and a healthy lifestyle are key to reducing your risk. Early detection and prevention can make a big difference. Pollution and kidney disease. What you need to know: long-term PM2.5 exposure increases CKD risk by 31% for every 10 micrograms per cubic meter rise, while short-term exposure to PM2.5, NO2, and SO2 also raises kidney disease deaths. Heavy metals like lead and cadmium are another threat, with a 2024 study showing high cadmium exposure makes CKD 54 times more likely, especially in those with diabetes or hypertension. Outdoor workers, children, the elderly, and those near industrial zones or high-traffic areas face the greatest risk. To protect yourself, check AQI, AirNow EPA, stay indoors when AQI greater than 50, use HEPA air purifiers, wear N95 masks, drink water, and grow air-purifying plants like English ivy and peace lilies. High-risk individuals include those with diabetes, high blood pressure, obesity, or a family history of kidney disease. Reduce risk by maintaining a healthy BMI, under 25 for Asians, under 30 for non-Asians, blood pressure under 130/80 mmHg, salt intake under 5 g/day, and HbA1c at less than or equal to 7%, while following a plant-based, Mediterranean, or DASH diet, quitting smoking, limiting alcohol, exercising, and getting annual kidney checkups. Take action today, share this with loved ones, and subscribe for more health tips. Watch our video to spot kidney disease early.